Hello, I am Dr. Bishwas. I am a doctor of this clinic. I confirm that you are Miss Lindsay Lohan, 20 years.
Yes, doctor.
Okay. How do you feel now?
Doctor, somehow better from before, doctor, but still now I have some swelling. Okay, so I'm very bothered about it.
Yeah, I am sorry for your condition. And is it okay if I discuss about your condition and our further management plan with you?
Yes, doctor.
Okay. And can you please tell me that how far do you know about your condition?
Doctor, I don't know very much, but one of the doctors or nurses, I think one of the nurses told me that I might have some allergic problem, allergic reaction. So this happened. What is it, doctor, actually?
And do you have any idea about those allergic problem, or did anyone say you about anything else?
No, doctor.
So will it be okay if I explain it to you?
Yes, doctor.
Okay. So can I draw a picture for you for your better understanding?
Yes, doctor.
Okay. So in our body there are lots of cells.
Yes.
Okay. And when we are exposed to any certain chemicals, any certain food, any certain uh, products, at that time, with that, our body shows some response. And most of the cases, there is no response because our body knows them. Okay.
Yes.
Suppose someone have entered into your house and you know him, you will not show so much reaction. But if an unknown person enter your house, you will show a lot of reaction. Do you
Yes.
get?
Yes. Yes,
uh,
doctor. Yes.
this type of reaction happens to our body when our body is exposed to certain products that is not known to our body.
Yeah.
We call them allergen. Do you get me?
Yes, doctor.
Okay. And as we respond by shouting or by calling someone, and our body tissue also responds to them by secreting some products.
Hmm.
Okay.
Okay.
When the products comes to the body, it acts on certain organs of our body. Do you get me?
Yes, doctor.
So it can comes to the lungs. When it comes to the lungs, it causes constriction or narrowing of our windpipe, so that they can develop shortness of breath. Okay.
Okay, doctor. Yes,
And
doctor.
when it comes to the skin or under the skin, then there is swelling and some redness, increased temperature that happens there. Do you get me?
Yes, doctor.
Okay. And sometimes it can also comes to our bowel, so we can develop diarrhea at that time.
Okay.
Is it clear to you?
Okay, doctor.
Okay. And it is not only certain types of foods, it also can happen with certain type of products, chemicals. Even we use shirts, even sometimes some types of gloves, some types of injection, some types of medication. That can happen to anything that is considered unknown by our body. Okay.
Okay, doctor.
Okay. And it is certain sometimes it is not quite sure that why this our body responds to these products, where the where other person doesn't respond. Do you get?
Well, doctor, you're telling that only I am having some problem with some specific things while other persons don't.
It is certainly like that. That some person may show some reaction to certain products where the others don't have any problem with that.
Oh, really, doctor? Then uh, it's very unlucky for me.
Okay. And I can understand this. And may I know that have you ever had this type of reaction before?
No, doctor, no. This is the first time, doctor.
And this time, do you know that what would be the cause?
No, doctor, I think the nurse told me that I had some food allergy, but I don't know it. Know about.
Okay. And did you take any specific type of food before that you didn't take before?
Well, actually, doctor, uh, I'm new here. Okay, so in this community and my friends, they told me that there is a specific type of salad named cashew nut salad. Okay, so I have never had it. So I this time took it for the first time, and then this occurred, doctor.
Okay. And actually, we are also suspecting that you are having allergy to this type of cashew nuts. Okay.
Oh, really, doctor?
Okay. And actually, it seems that it is very horrible condition, but actually avoiding those products, you can lead a totally completely normal life.
Okay, so that's something inspiring for me.
I am sorry to say, but it is something serious. It can sometimes become so serious because, as I have told you, that sometimes it can cause narrowing of
But
the windpipe.
doctor, another thing that actually I have had peanuts before. I may not have had cashew nut salad before, but I think I have had some peanuts or nuts before. So why this time this occurred?
Okay, actually, sometimes it happens that people may show reaction after a long time exposure to those. Sometimes the first time they may not respond to this, and after that they can show the response to that.
So, doctor, how can you help me, doctor? This attack was so serious, doctor. I thought that I might not survive. So, what can you do for me, doctor?
Okay, for this, we are going to give you some advice you have to follow up, and also we are giving you some medication.
So, really, doctor? So, what is it?
Okay, and as I told you that our body responses to the certain types of products, so it will be the best management to avoid those products. Like in your case, you already told me that about nuts, some cashew nuts. So avoiding nuts and their products will be the most important management for you.
Okay, doctor. And suppose, well, actually, I have to go to restaurants and some other places. I live alone. So at times I might not check that all the time. So isn't there anything that can help me at that time, or anything that I can have, any medication that which can help me?
Okay, I can understand that. And in that case, when you comes to any certain types of product that you are not known, then you should always make sure that these are not containing certain types of product by asking to someone that who knows that, and also reading some ingredients of that. That will be helpful at that point. And do you get me this time?
Yes, I get you, doctor. But still, now you are. I will try my level best. But doctor, I am so afraid of this condition that it was so serious, doctor. Is there any medication that I can have with me, or in an emergency situation like this? Because
Yes.
this whatever this time, actually, I was very close to the hospital. I came within 5 minutes, doctor. So I think that I was safe. But I think even if this case, if I was late for more 30 more minutes, I'm afraid whether I would be alive now.
Yes, there are certain medication we call it adrenaline or epinephrine. Have you ever heard of it?
No, doctor, no, I have no idea about it.
Okay, actually, it is a pre-filled syringe that you can always carry with you. It is a small syringe, and you can inject yourself it whenever you develop some this type of symptoms again, like any itching, any flushing, any swelling,
So, doctor,
any
what are you saying?
shortness of breath at
I'm
that
very, I
time.
have been very, very, I'm very, very, very afraid of these needles. all my life, doctor. Cannot possibly inject myself.
Okay, but this is a problem with lot of people. But when we show them the needle, actually the needle is very thin and it doesn't cause any pain, and also it is a short needle. And whenever we show them live, whenever we discuss this issue with them in a live session, they usually get accustomed to it, and they accept it because it is not a fearing one. And if you have any specific fear about that, we can make an arrangement with the specialist nurse. They will be able to show you how to use it, and they will be able to uh, remove your fear, I think.
Okay, doctor. Okay, I can get it. Although I'm still a bit fearful, but may I know how will I know that when to use this medication?
Okay, and this medication is almost all time harmless. So certain symptoms, like if you develop any swelling, any flushing, any shortness of breath, okay, any itching,
Okay,
and we will give you also a list that when you should use that medication, so we'll get a better idea on that.
okay, doctor. And
Whenever you develop
uh,
symptoms, you will inject it. Yes, please.
okay. And doctor, actually, some other things. I am a traveler. Actually, I want to travel a lot. So, should I have to cancel my travels for this?
No, you can always carry this with you, and just inform the your travel guide and also your airline companies, so that they can be aware of your condition. And also you can always use a medical alert bracelet naming that you are having this type of condition, so anyone would be able to identify this condition earlier.
Okay. So, doctor, may I know that what if this medication does not work, doctor?
Okay, actually, this is a very good medication, and even after taking those medication, you should always contact the local hospital or a nearby hospital, because whenever you need any support after that, they will be able to cover it. Okay, and this is not the exact treatment. This is just an emergency savings that will buy some time.
Okay, doctor. Okay, that's all right, doctor.
Okay, so do you have any other question? 2 minutes remaining.
Doctor, I don't have any other questions, doctor. But still, I'm a bit afraid.
Okay, I can understand your fear, but as avoiding those certain types of food, and even if in the future you can came to know that any types of products that causes this type of symptoms, then you should always remove that. And we have some test for that, so we can refer you to the test clinic, that they will be able to find out that to which commonly types of products you are allergic, and they will advise you to stop that. Do you get me?
Okay, doctor. And actually, at this moment, you told that what type of food. Well, uh, actually, you were telling that I may have allergy to some more things as well. Am I right?
Yes, I am sorry to say that, but it is possible.
Okay, doctor. Okay. And do you think that actually it was so serious? But do you think that I should inform my uh, friends or my guardians
Yes,
about it?
yes, I was trying to discuss this condition with you also. We would like to like you to share this condition with your friends, and if and family, whoever live nearby you, and if you need help, we will also teach them, so that they can also inject you, or they can also help you, or even they can also call the emergency at any time they need. We will do that upon your upon after taking your permission.
Okay, doctor.
Do you have any other question?
No, doctor.
Time up. Thank you.
Okay, so what was your task?
My task was to explain this lady about the anaphylaxis reaction or allergic reaction, and then explaining the importance of avoidance this type of products that she is allergic to, and also explaining the importance of adrenaline injection.
Okay, I think you have done really, really well. You have covered all issues here. I think almost all issues, and I don't have too much things to say about this case. I think, and it was really good. So, uh, do you yourself want to add anything?
Okay, I just want to that I should have asked about what happened before the onset earlier, so that I could get better idea on that.
Yes, you could have also asked that what happened during that, or who was present at the time. Okay, I think you could have asked about that, how she was brought. I think that could have been asked. In short, I think. What do you think?
Yeah.
Yeah. So otherwise, it was quite good. Uh, it was quite good, and you also very wisely asked if any previous episodes was present or not. That was very, very wise. And another thing that I think you could have asked, that whether there was any family history of present or not. Did you ask about it?
No, I didn't think that it is important in this case, so I didn't ask. And is it important?
Well, uh, I think you can ask it because she is actually going to tell it to her family. So uh, at times the family support can also be important. So if there is also, she does not, suppose she doesn't know about it, but one of her family members might be affected by this, so they already know how to deal with it. So it can be easier for them. So I think it might be asked. I'm not quite sure as well, but I think that it might be asked. I'm not quite sure. Hello.
Yes.
Okay. And any other thing? I think you have covered almost everything in this case.
Okay. Should I start it?
So will you go to the